Hey guys, here to go over your exercises for acute lower back pain. And so we give these exercises for people that have chronic bouts of back inflammation. You kind of always feel like your back's going out. Maybe you've already worked on trying to decompress your back. Now you kind of got to get more into the mobility and the strengthening side of things. So this is what we give these exercises for. The first three are going to be about general mobility through the lower back, and the last few are going to be about strengthening. So the first one here, it says rise up on your elbows, keeping your hips on the floor. So you just want to hold this position. And what we're trying to do is prime the lower back for the strengthening exercises that we're going to do in a moment here. So you're just resting here. Now, a lot of people that have really tight lower back, when they do this, their pelvis kind of lifts up off the table. That's a sign of a really tight lower back. So we want to try our best to rest the pelvis flat on the ground, rest that lower back, and feel the arch that's starting to happen in the lumbar spine, okay? You can hold it for 30 seconds and you can kind of come up and down like that and repeat it a few times. Next one, to go a bit further into that position, you're gonna press up like this, okay? Again, making sure that your pelvis doesn't come off the ground, focusing here. If you can only get your elbows to this part, because that's as high as you can go, and that's fine. Just go as high as you can, but if you can fully extend your elbows, that's fantastic. Making sure, again, that your pelvis is still in contact with the ground. You're gonna get more arching in your lower back and better mobility through your lumbar joints when you do it that way, okay? The next one, if you can tolerate it, is to take it a step further, and I'm gonna stand up, and again, I'm gonna support the back of my pelvis here, and I'm gonna start to arch my spine back as far as I can go. That's now bringing the facet joints through my lumbar spine through their almost full range of motion, which is amazing to break apart any tissue adhesion, early arthritis, capsulitis, things like that. So really promoting that full range of motion. The last four are to start to strengthen some of the lower back muscles in the core. There are some people that get lower back pain simply because their muscles are very weak. They sit all day, they don't use their core, their lower back. So these are simple exercises that you can do to start to strengthen things. The first one, you can put a pillow under your stomach if you like, or just lay flat on the ground. Bring your hands behind your back, and then slowly lift your chest up off the floor. You are going to feel the muscles in your lower back engage. Try to hold that for as long as you can. I think on the sheet we put, hold for at least 5 seconds. Sometimes people do it for a second and they go, oh, and they fall down. So really try to hold it for at least 5 seconds. If you can go more than that, that's fantastic. Repeat that a few times. The next one is going to help promote muscle symmetry along your spine. Some people will call this like a Superman exercise. So you bring your hands up this way, your feet stay back, and you're gonna go opposite arm, opposite leg, hold, and alternate, and hold. And there you're gonna feel different muscle groups through the glutes and your lower back engage, and that's gonna help strengthen that area. Then to strengthen the front side of the core, very simply, we all know about a sit-up. And so literally all you're doing is just trying to sit up. Again, don't bring your head straight forward like this. Try to look straight at the ceiling. Body comes up here. Hold, engage the core for as long as you can. If this is comfortable for you and you want to really try to bring your chest up to the sky, hold for at least 10 seconds. If you can get 20 or 30 seconds, that's fantastic. Okay, and then the last one, that's going to get more of your upper abdominal area. The last one to target the hip flexors strengthening and the lower abdominals. You kind of kick your leg and hold in that position. So try to be straight on the floor. Leg comes up, hold. If you come too high, now your foot's in line with the rest of your body, so you're not really strengthening anything here. So you kind of want to hold it almost like at a 45-degree angle. Try to hold that position. It's important to keep your lower back flat on the ground. If you feel like your body's rotating this way or this way, it means you're compensating. You're not getting as much out of the exercise. So really trying to keep both butt cheeks flat on the ground as you're doing this. Hold this position. Alternate this way. Okay, to make it difficult for yourself, you kind of bring both up at the same time and go like this, even better. But if you can kind of only do it like this one at a time, that's fine too. Work within your own limitations. I don't want you to feel any sharp pain or shooting pain when you're doing these. A little bit of tightness is normal. If you have questions, please just let us know.